Hello, this is Paul Rothenberg. I'm an orthopedic surgeon in northern New Jersey. And this is an arthroscopic rotator cuff repair for partial thickness rotator cuff tear. First step is to locate the tear. This is done with a combination of blunt obturator and arthroscopic shaver. The tear is then expanded and all poor quality rotator cuff tissue is removed. The rotator cuff footprint is then decorticated with an arthroscopic shaver, creating a good healing surface for the rotator cuff repair. A fiber link suture is placed anteriorly in the rotator cuff to prevent any dog ears at the end of the procedure. My first medial row anchor is placed anterior on the rotator cuff footprint, just lateral to the articular surface. My first fiber tape is then passed using a scorpion suture passer in the anterior portion of the supraspinatus tendon. These steps are then repeated for the posterior medial anchor. Next, the anterior link and one fiber tape from each anchor are retrieved out of the lateral portal. Then, using a colored punch, I choose the location for my first lateral row anchor. The anchor is then introduced into the pilot hole created by the punch, and the sutures are sequentially tightened. Once all the slack is removed from the sutures, thereby reducing the tendon onto the footprint, the anchor is then advanced and screwed into place. The sutures are then cut, completing the first lateral row anchor. The retention sutures are kept in case they are needed after the repair is completed. These steps are then repeated for the second lateral row anchor. After the repair is complete, the sutures are then probed to see if there's any areas of looseness in the construct. In this repair, there is no looseness, so the retention sutures are then cut. The shoulder is then internally and externally rotated, demonstrating a secure repair.